So let me go ahead and start with the person on my left, Steve Davis.
Thanks, Gina, and it's a pleasure to be here, even a little blurry-eyed post-red-eye, but it's always great to be here, and glad to participate in this panel. I'm going to bring kind of a practitioner's voice here, and I will try to tie it back to the previous conversation, but really coming at it as somebody who's been in the trenches for most of my career, actually, not so much in global health, but in a number of ways, putting deals together and thinking about how do you govern structure and govern different types of partnerships. I ran the McKinsey for a number of years, in the global social sector practice. I actually oversaw the governance group back when we came into the Global Fund. And then I, as a recovering corporate lawyer, have done hundreds of M&As. And I also teach at Stanford in the business school where particularly about this sort of multi-sectoral partnership model. So those kind of at the meta level gets into all sorts of issues around, models, structure. Do you engage, do you either structure your board with a much more, constituency model versus other types of models? And happy to refer back to those learnings if useful. But let me put the perspective more from my role as the CEO of PATH, which in the global health community is a leading player in the innovation space, has kind of been at the center of many of these partnerships in global health over the last 40 years, and PATH is celebrating its 40th year this year. At the table at Gavi, at CVI, at MBI, at Manafrovac recently, we've been very active in helping shape CEPI. So a lot of these very significant global multilateral, multi-dimensional partnerships have been participating. But I actually think in this conversation, it's also important to kind of take it down a level to some of the many partnerships that are happening more on the ground in the moment, sometimes one-off, sometimes multi-year, that are happening in the global health space, where you're bringing private, public, social sector partners together to get a specific project done, not necessarily set up a long-term mechanism, but actually to get the job done on the ground. And I think some of these issues are relevant for both. And we've been actually, in our own world, transforming our own thinking about governance. PATH is a reasonably large, complex organization, has many components, many different funders, has a vaccine development group. We have people on the ground. We have entities around the world. So we've actually been transforming our own thinking around how do we govern ourselves, how do we put together better mechanisms so we have the appropriate level of oversight, the appropriate level of transparency, the appropriate level of accountability within our own direct partnerships. So most recently, and I'll come back to these, we've stood up a new Center for Vaccine Innovation and Access and are still in sort of negotiating with how do we manage that vis-a-vis particularly our biggest partner there is the Gates Foundation, and what is our governance structure for managing that. We've visualized No Malaria, a very large multi-dimensional partnership to work on malaria elimination in sub-Saharan Africa, where we're bringing in a number of corporate players and bringing in more and more capability with governments and corporate players to have, particularly in the telecom, these are companies, a lot of people in the Beltway don't know their names, but if you live out in the world I live in, they're like Twilio and Box and Tableau and some of these really cutting-edge technology and data visualization companies. And then we're also putting together some interesting new work with our own sort of key partners, like how do we create a more strategic relationship with GSK, and how do we structure that in a more strategic manner, and what's the governance mechanism for that? So happy to talk about that. So I have a few observations about these various things that I'll just share very quickly at the top. One is I'm kind of been emphatic most recently, both in my teaching and writing, but also around the world, like I wish we could stop using the stupid PPP language. First of all, it's just old, it's dated. But second of all, most of these need to be thought of as multi-sector. And PPP leaves out this whole idea of sort of where does the social sector fit in. And honestly, a lot of research recently has shown that most public private, literally, industry, government partnerships don't work very well unless they have a social sector partner. The effectiveness of partnerships without having a philanthropic or a NGO or a nonprofit or an academic partner or some mix of those are less effective. So we need to start looking at the evidence and saying multi-sector partnerships are the way to frame this conversation and the way we need to bring different people to the table. And part of that comes as a person in running an NGO where civil society is sort of the asterisk at the end of oh yeah, civil society too. And we got to get over that. In fact, I've had conversations with the WHO on how do we start breaking down their own referencing to civil society, because civil society is everything else, and that's an inadequate. So there's a whole set of languages, but that comes with a mindset, and it comes with some different actors. There is no question, I think the evidence would show we're going to see an increase in these different mechanisms to do public-private partnerships. All the data will support that in terms of the literature on social innovation. But there's also evidence that the effectiveness of these public-private partnerships are not, they're not actually increasing at the same rate. So in some ways, we're seeing a lot of adventures in public-private partnerships, but we're not seeing as much outcome as promised. And so I think we've got some real work to do in the next few years to try to make sure that as these grow, their effectiveness grows, and we can talk more about that. I think the third point I'd like is I do think accountability and transparency are key. The structure of the paper makes sense to me. I would get down to the sort of more pragmatic farm boy. I grew up on a ranch in Montana. Like, okay, but about what? So accountability to what, about what? Accountability, transparency. I was in a meeting the other day, and somebody said, transparency is not a value. If it's a value, it'd be intrinsic in everything you do. We mix it up. It's a tool. It's a tool we use effectively, sometimes ineffectively, but to your point, sometimes it's not. As a CEO, you can't be transparent about everything because there's proprietary information, there's confidential information. You have to think of this not as the gold standard, but as an effective tool. I would argue there are a couple other dimensions very high. The work I've done on governance in social and nonprofit and for-profit sector is, the word I come over and over is altitude. And that's really, at what altitude are you asking your various governance structures, whether it's your board or your advisory board or your steering committee or your SAB or whatever, at what altitude are they actually being asked to play? And is that clear and intentional? And that's where the stumbling is at its greatest, where you can't get, the role between management and board, or the role between one board and the other board. And honestly, what we've learned a lot is it needs to be dynamic. That an effective governance organization needs to be able to dive in and then dive up, but to keep moving up and down altitude. And I think that's one of the dimensions of governance that we need to work on. The second word I would think about is alignment. I think the biggest thing we see in the data on public-private and social sector partnerships is that where they stumble is the objective, the alignment around the objective was just not clear enough in the beginning. And successful partnerships had a very clear objective. They usually were pretty well resourced, which is another dimension of this, but that objective. And so I pushing for that, and it may seem self-evident. And the third, I would argue, would be adaptive, because I think one of the challenges we have in the health sector and the global health sector is our partnerships tend to be either there's these mega partnerships, and you will talk about one, and long-lasting, institutional, let's get them going, and they will, but then there's often these one-off partnerships that just, like and we've got them. So I've been writing some on how do we create more portfolio approaches to public-private and social sector partnerships. So I think if we could work on that, that would be great. I would love to talk more about, sort of the elements of corporate engagement and some of the work we've done with GSK and some of the others on structuring a way to have this governed without having it over-engineered. Because I think that's one of the other challenges with strong governance is finding, again, how much engineering you want to do with this. But those are some initial thoughts, and happy to take questions later.